We are very excited to be here today with Dr. William Gibson. He's a diabetologist and the program director for the Diabetes Assessment and Management Center, which is the only dual accredited center in Louisiana. He has extensive clinical experience in managing patients with insulin resistance, with type 1 diabetes, type 2 diabetes, pre-diabetes, obesity, heart disease, hypertension, high cholesterol, and atherosclerosis. And he brings an extensive understanding of lifestyle modifications that can make significant positive impacts on diabetes management and diabetes reversal. Thank you so much for being here today with us, Dr. Gibson. We're looking forward to it.
Thank you, Dr. Khambatta. I'm glad to be here.
Fantastic. So, I've had a very unique opportunity to work very closely with you over the last 5 years. And I've been able to see how your work in Louisiana is really impacting and transforming the lives of hundreds, if not potentially thousands of patients over the last 5 years. And a lot of those patients live with either prediabetes or type 2 diabetes. So can you tell our audience a little bit about the Diabetes Assessment and Management Center and exactly what it is that you focus on?
Sure, absolutely. As you mentioned, we're the Diabetes Assessment and Management Center. We're located in Shreveport, Louisiana, and I have a primary care clinic, but we have an emphasis on diabetes, and we see about 250 to 300 patients a week, and you've been an integral part in that credentialing process with both the American Diabetes Association and the American Association of Diabetes Educators. Developed a 9-visit and 90-day treatment algorithm, and using some universal principles of education, motivation, accountability to really help some people reverse their insulin resistance and have people getting off shots, getting off pills, and liberated from finger sticks, and some folks with type 1 that are really increasing their insulin sensitivity. So also do primary care. So we do cough, cold, sore throat, backache, all those things, but really make a big difference in people with diabetes. All the principles that you and Robbie are such advocates for, the low-fat, plant-based, whole food diet.
Yeah, I think one of the primary differences between how you operate and how we operate is that, we like to get lost in the nuts and bolts of how to actually transition from a standard American diet or a low carbohydrate ketogenic diet into a low-fat, plant-based whole food diet for people with type 1, type 2 prediabetes. And we're very specific about lifestyle improvements, how to measure your carbohydrates to insulin ratio, et cetera, et cetera. And I think you also have extensive knowledge in this, but you also have a really simplistic approach that you are brilliant at communicating. And that simplistic approach is really effective. So tell our audience, what do you tell your patients when you see them about how they can totally transform their life?
Sure. I tell people to eat the rainbow. So red, orange, yellow, eat an apple, an orange, a banana every day, 1 salad, 1 serving of beans, and walk for 30 minutes a day. And then I go on to guarantee patients results for that. And I've got local physicians that are referring patients here because we have the accredited diabetes education program to meet the standard of care. A patient should receive diabetes education when they're newly diagnosed, if they're uncontrolled, if they had a recent hospitalization. And so, physicians know and understand that lingo of meet the standard of care. And, unfortunately, as you're well aware, there's not really much nutritional training, if any, in the medical education process. And you see the miracles that happen when people transition to a low-fat, plant-based whole food diet. So as you know, about 40% of the patients that I care for have Medicaid. So I have to work at a literacy level for about a 4th to 6th grade level. And, trying to just change somebody overnight to all fruits and vegetables and beans and whole grains is not a very realistic approach. So that's the reason I've developed the apple, orange, banana, salad, beans. And so using this principle of accountability, First, when I come in out, we do an A1C, we measure patient's blood pressure, we do their cholesterol panel, and then we have a little patient education book, explain to them their A1C value, how that relates to their average finger stick glucose, set a personalized target, talk about their blood pressure, their cholesterol numbers, the signs and symptoms of hypoglycemia, the 15-15 rule. And then I start showing them pictures of patients that have gotten well. And as there's well represented on our website, we've got over 100 patients. They're all holding their signs with their drops in A1C and their weight loss. And so I really want to incentivize these patients to know, hey, wait a second, this is something that you can accomplish. And I tell people, call me old-fashioned, but I prefer results. So I like to show patients what you can attain. And then I know if they retain about 20% of what I share with them, that they're doing really well. So what I do is I cover a lot of material that first visit, and then I give the patients that logbook, and I tell them, hey, you're going to write down what you eat for breakfast, lunch, and dinner. You're going to do a finger stick before you eat, and you're going to bring that back to me in a week. I say, well, look, I know that you're doing some things you shouldn't do, and you're not doing some things that you should do. That's all of us, but with more accountability. So certainly they shouldn't do Cokes, candies, cookies. But I say, whatever you're doing, put it in this book and bring it back to me in a week. So by the time I see you in a week, you're already doing better than today. So then I show patients a picture of a professional continuous glucose monitoring report. And so we all make better decisions with better information. And this continuous glucose monitoring report makes a tremendous difference. Once I've got patients to do a week's worth of logbook, they come back. When I can show a patient the difference that their improved behavior choices and their increased activity makes in their glucose control, it makes a phenomenal difference.
Now, we have seen the results on your website, and it is extraordinary. Your simple approach absolutely does work. Now, as people start making these adjustments, oftentimes they need to reduce their medication. As far as we know, there is not a standard for how to do that. So can you give us some insight on how you work with patients as they need to reduce their medications?
Absolutely. I use a pretty simplistic approach for medication titration, and that's going up or going down. Patients that have type 2, they're using metformin unless they have a kidney problem or they have a GI intolerance. If we're unable to get a patient with type 2 control with metformin, we'll use a DPP-4. Then if they're still uncontrolled, we'll use a basal insulin. Then based on the CGM report, we may add prandial control or continue to titrate their basal insulin. So I would tell you what makes a big difference is the education process so a patient recognizes the signs and symptoms of hypoglycemia. And I have very frequent follow-up. So, the exciting thing is when somebody transitions to a low-fat, plant-based whole food diet, they get some pretty radical results. For instance, I had a lady, she was taking 50 units of basal insulin twice a day, and she was just using regular insulin for prandial control, doing 10 units at mealtime. She really bought in. She saw these powerful testimonials, and so she goes plant-based. She says, within 10 days, she's having hypoglycemia for those 10 units at mealtime. So as far as a particular plan, process, and protocol, I tell people there's, inter-individual variability. So some patients are going to respond more quickly. Mostly what I do is have a strong emphasis on those signs and symptoms of hypoglycemia. Once a patient knows and understands that, it will depend. Typically, a patient with type 2, we're going to decrease their prandial control first. But, obviously that's dependent on whether it's a daytime hypoglycemic event. If they're having nocturnal hypoglycemia, we're going to cut a patient's basal. So when we're reversing insulin resistance, typically a patient will reduce or eliminate their prandial control, then will decrease and eliminate their basal insulin. They continue to improve, eliminate the DPP-4, and finally the metformin.
Okay, it's very simple, very straightforward. Now, you are what we would consider an enlightened physician. So you are teaching your patients.
That's quite a compliment. Thank you, Robbie.
Yeah, teaching your patients to use food as medicine is rare these days. Sadly, as common sense as it is to us and a lot of people listening, it's still rare. So, and we also know that doctors just aren't getting this education in school. So what are you doing to educate your fellow physicians about this approach?
Well, I'm glad you asked that question. So it's interesting. You talk about educating other physicians. We've got a local university health system, and we're interested in building a collaboration. We've started having some dialogue. I tell you, most of what I do education-wise with other physicians has begun with patient referrals. And so, a patient will come and they're terribly uncontrolled. They're having glucose toxicity where they're diuresing and they're in really bad shape. And I'll receive a patient referral, and frequently within 90 days, our patients see a 2 to 4% drop in their A1C, frequently on less medicine. So they go back to their primary care physician, and then I start getting calls because either they're making a presentation or they're going to share some information and they want to know what we're doing. And when they call, I tell them the same thing I shared with you, that we do an apple, orange, banana, a salad, and a serving of beans, and walk 30 minutes a day. So right now we don't have a specific teaching method or mechanism to disseminate the information, but we're looking forward to developing that.
I want to go back actually to what you had touched on earlier, which is that this approach is actually very simple, right? Apple, orange, banana, a salad, serving of beans, walk 30 minutes per day. There's a lot of people who are intimidated when they first are thinking about transitioning to a low-fat, plant-based whole food diet. And they start to, do some rough calculations in their head, and they say, well, if I want to buy all that produce at the grocery store, it's going to be real expensive. And as a result of that, it actually holds them back, and then they delay their transition or they never make their transition altogether. True or false? Eating a low-fat, plant-based whole food diet is more expensive, is more complicated, or is it truly a way that you can change your health without actually spending more money at the grocery store?
Well, I watched a really fascinating video at the AAD conference several years ago. Dr. Tim Harlan has begun the Goldring Center for Culinary Medicine there at Tulane, and he has a registered dietitian that takes a couple through I guess the grocery chain is the Piggly Wiggly in a rural area, and they show how they use a SNAP budget for a family of 4. And it's not all low-fat, plant-based whole food diet. They had a variant using more of the Mediterranean diet, but a strong emphasis on more fruits and more vegetables and more beans and more whole grains. And they actually took the patients through the grocery store. They filled the buggy. And so it's a very practical way to go. Absolutely, you can do it. Now, does that mean that, some folks won't have to buy bags of dried beans or more greens? But, I explain to go, well, it's kind of like you either make time to be well or you'll make time to be sick. Ultimately, the cost of poor choices, with complications like, decreased vision or, kidney problems requiring dialysis or loss of sensation in nerves in people's feet. So certainly they can't go to the local drive-through and order off the dollar menu and eat the things that we're encouraging them to. But there are some things that they can do, some choices where, we have them some places they can order some baked potatoes and get some things on the side. Sometimes they can order salads and, avoid the meats and to pay attention to the dressings. So, if a patient's motivated, we try to give them the tools that they need to actually accomplish what they're looking for, even on a limited budget.
Yeah, that's actually, we've seen that over and over again. It doesn't really matter what part of the country you're in. You could be in Los Angeles, where food generally costs a little bit more money, and you can still save money. We've actually made some trips to the center of the country, gone straight to Walmart, just look through the freezer section, look through the bulk section, and, you can find things, low-fat, plant-based whole foods all over the place that are actually very economical. So I'm glad to hear you say that, because it's actually, we don't want that to be an obstacle for people. And, it's important to sort of like talk about it really openly. Another thing that I know you have a lot of experience with is not only helping people transition to a low-fat, plant-based whole food diet or move in that direction for improved diabetes health, but you see tremendous improvements in your patient's cardiovascular health as well. We've had plenty of conversations about that. So can you go into a little bit of detail here about what types of improvements you have observed and what you know to be true in the research world about cardiovascular health when you adopt a low-fat, plant-based whole food diet?
Oh, certainly. Well, I mean, I can't help but defer to Dr. Esselstyn and Dr. Ornish to go, hey, they've proven that these intravascular plaques are reversible with a low-fat, plant-based whole food diet. But the benefits are innumerable. I mean, it's not just the diabetes diet. It's the cholesterol diet, the hypertension diet, the weight loss diet. If you want to cut your risk for heart attack, stroke, cancer, decrease the incidence of gout, I mean, it is the solution for sick people. 80% of chronic disease is behavior. And so, between people smoking cigarettes, drinking alcohol, time on the couch, and the food choices they're making, you could cure most chronic disease. So, I would say that the biggest difference I notice in the short term is people are absolutely amazed at their energy level. And so diabetes is such a slow moving catastrophe. They don't realize how it's really, many of them, it's robbed the joy of living. Their energy level is incredibly low. They didn't realize that when they're unable to get that glucose into the cell to utilize it for energy, it's affecting every part of their well-being. It affects their mood. And as you mentioned, the comorbidities. So, they don't heal selectively. So somebody's diabetes doesn't just get well. Their congestive heart failure improves, their COPD gets better, their depression improves or resolves. So it's just absolutely nothing shy of absolutely miraculous, the changes that take place when, people use these principles and make some better choices.
That point about the body not healing selectively is such a big deal. Trusting in the wisdom. You give the body the right foods, the right amount of exercise, healthy relationships, sunshine, water, and all of a sudden it takes care of the highest priority items. And that's what it does in its infinite wisdom. So you have talked about your success stories. We've seen so many on the website. We have gotten the chance to hear you share them at some of our retreats. So can you share with us maybe a type 2 diabetes success story to inspire our listeners?
Sure. I guess the one patient that comes to mind is a gentleman that's actually in his 70s, was referred to me for diabetes care. And so went through all the things I enumerated to you, checked his A1C, his blood pressure, his cholesterol numbers, told him about signs and symptoms of hypoglycemia, the 15-15 rule, told him the same things that I told you, gentlemen, the apple, orange, banana, the salad, the beans. I gave him a logbook. I gave him a follow-up in 1 week. And so the second week, we used the continuous glucose monitor. We saw him the next week, reviewed his report, and his A1C was a little over 10. And so I'm checking his logbook and going through, checking his medication administration record. And, I asked him, was he taking his metformin? And so in meeting the standard of care, I had prescribed his metformin. He said, well, no, I didn't fill it. And I said, well, gosh, at this point, I'm looking at his logbook. I've got this CGM report that shows an anticipated, 3% drop in his A1C. And I said, well, I'm actually checking A1Cs monthly. So although it's a 3-month average, I can see a reflection monthly. And it's a huge opportunity to either affirm a patient's better choices or to give them additional guidance. And so certainly when I checked this gentleman's A1C, he'd already dropped over 1%. And so, now he's, like I say, he's in his mid-70s. He's got an A1C that's been below 6. He's never actually taken a single dose of metformin. And, that's all due to, him not following my directions. So, I don't do this thing perfectly, but it's pretty exciting when a patient says, hey, they're going to practice these principles, and to show a patient that had gone from an A1C over 10 to below 6 and never took a dose of, medication to reduce their blood glucose is pretty amazing in my book.
That's awesome. Actually, that reminds me of Adam Sudd, who's a coach in our coaching program. He was diagnosed with type 2 diabetes. He ate himself to 320 pounds. He adopted a low-fat, plant-based whole food diet, started to lose a tremendous amount of weight. And then when he went back to his doctor, he told the doctor, or the doctor took a look at his blood glucose, his blood pressure, his cholesterol, and said, wow, it looks like the metformin's really working. And Adam said, with all due respect, I never got metformin. I haven't been taking it at all. I've been eating a plant-based diet. And the doctor responded by saying, that makes sense. He was like, what? That makes sense. How come you didn't tell me this earlier? Right. So I think it's a universal phenomenon that seems to be happening more and more and more.
Certainly. I kind of take for granted that, I have patients, they come to me and they say, well, sometimes they make these radical improvements in their A1C drops and they start getting well. And they say, well, golly, why did nobody ever tell me this? And I've had patients come in and when I start showing these testimonials and saying, hey, you can get well, off shots, off pills, for these folks with type 2, once they have an A1C less than 6 and they're on no medications, they're no longer doing finger sticks. Now I see them monthly for a finger stick A1C, make sure that they're staying on track. But I've actually had patients, show them those testimonials, just start weeping. I mean, just, the idea that they can get well and nobody's told them. And honestly, I don't have a good reason for that. I would tell you, I was a registered nurse for 6.5 years before I went to medical school. And I did an internship in general surgery before I changed to family practice. And I will tell you, in the university system, there were a lot of really good mentors, a lot of really compassionate physicians. But unfortunately, I believe that there was kind of a bit of an institutionalized mindset. So, I'm kind of betwixt in between, the idea that someone was overweight and suffering amotivational syndrome. And so kind of like they were fat and sick and helpless. And that's just not the truth. There are people that continue to surprise me, have an exceptionally large body habitus, got multiple orthopedic problems, and there would be a lot of reasons maybe that this person would make a change. And I'm continually surprised and encourage people that advance through adversity, make some better choices and get some pretty amazing results.
Yeah, it's so good to see. It's so good to see. I think you're right in the sense that there's a lot of people who are really motivated to want to take full control. And, as long as you present them with the right information, they'll do it. Gone are the days where people say, I don't want to change. I mean, there's a segment of the population that does think that and behave that way. But I'd say for the overwhelming majority of people, if you present them with an option of how they can actually truly reverse metabolic disease, they'll take it in a heartbeat. Talk about type 1 diabetes. We both live with type 1 diabetes. You've also worked with a lot of patients with type 1. So share a story about improving metabolic health in someone with type 1 that you've helped facilitate.
Certainly. I have a gentleman that comes to mind that he came here really struggling. His A1C was almost 10. And likewise, I shared with him the value of low-fat, plant-based, whole food diet. And, he spent some time with our diabetes educator, really had to go back and tune up. Although he was familiar with carb counting, he wasn't really doing a good job. Pretty amazing. It wasn't long. Within several months, he had his own Dexcom. Every time I see this gentleman, he's had an A1C that's 5.6, and it was a really difficult thing for me to explain to him. Said, look, you've done remarkably well. That's too tightly controlled for people that are type 1. That's according to what I think is safe so that they can avoid hypoglycemia. But he notices there's a difference. He has a fiance that has a young child, and he's just had to do a lot in the way of food preparation because he can tell a difference if he eats a meal that's high in fat. Not only is he going to have an excursion in his glucose 12 to 14 hours later, sometimes it takes 2 to 3 days for him to get his glucose back where we would like for it to be. But so, for somebody that has type 1 diabetes and he's doing multiple daily injections, he does use a personal continuous glucose monitoring device. But, patients that are able to get their A1C, well, I prefer it be right there around 6. I don't like people with type 1 to have an A1C below 6 because of the increased risk of hypoglycemia, but all the same principles for reversing insulin resistance. So low fat, plant-based, whole food diet, and, high carbohydrate. And so people that are, I explain to people, I can't explain the exact physiology, but I have patients that have type 1 diabetes that eat more fruit and have better control. And so, I can't explain the biochemistry, but I will tell you something in the way that God created the food that we consume in its natural form, that folks, when you have type 1, that they'll always need some insulin, but multiple daily injections with the A1C below 6.5, numerous patients like that.
Yeah, I mean, we've seen it over and over again. Robbie and I are sort of living examples of that. The more fruit we eat, the better our blood glucose control becomes, and the less our insulin use becomes as well. So,
and the retreats. I mean, it's the people that quadruple their insulin sensitivity within just a matter of days. It's pretty amazing. The help you guys are providing.
Yeah, we appreciate that. We appreciate that big time. I think a couple of take-home messages here are that, keep it simple. It can be truly very simple, which is what some of our other speakers have also talked about. An apple, an orange, a banana, a serving of salad, a serving of beans, walk for 30 minutes a day. That's a surefire prescription for significantly improving your metabolic health. And then secondarily, what you touched on earlier, the magic of the magical 99-cent logbook, right? You start writing your blood glucose values down. You start tracking the stuff that goes into your body. Boom, all of a sudden that's where the epiphanies start to come. And that's when people get true insight into what they're actually putting into their body. And as soon as those gears start to turn, then, you can see tremendous improvements. So thank you for doing what you do. I know you're changing the lives of so many people right now. And, you're really working in a community that needs your help. And, it's been a pleasure to work with you over the last 5 years. We're going to continue to work with you as time goes on, and we really appreciate everything you do.
Thank you. It's quite an honor. Appreciate all that you guys do. Keep up the hard work.